Hello, and welcome to this week's episode of Medisodes. This week we will discuss the lymphatic system, a less commonly known aspect of the human body. To start off with, I'll go through what the lymphatic system is. The lymphatic system consists of lymphatic vessels, which carry a watery fluid called lymph through them. Distinguishing this from the cardiovascular system is that the lymphatic system is not closed, and does not have a pump like the heart. However, lymphatic vessels are somewhat structurally similar to veins, with relatively thin walls that carry lymph at low pressure. Because of this, larger lymphatic vessels contain valves to prevent the backflow of blood under the influence of gravity. Approximately 20 litres of plasma flow through the body's arteries and smaller arterial blood vessels and capillaries every day, and after delivering nutrients to the body's cells and tissues, and receiving some of their waste products, about 17 litres of plasma return to the circulation in veins. The remaining 3 litres seep through capillaries and into the body's tissues. The lymphatic system collects this excess fluid, which is the aforementioned lymph fluid, from tissues in your body and moves it along until it's ultimately returned to your bloodstream. The lymphatic system consists of lymph vessels, ducts, nodes, and other tissues. The lymph vessels form a network-like structure that reach most of the body's tissues. Lymph is drained through progressively larger vessels until it reaches the two main channels, the lymphatic vessels in our trunk, where filtered lymph fluid is returned to blood in veins. The lymphatic system consists of several lymph nodes that contain immune cells that assess for foreign material such as pathogens as lymph flows through them. They are small, bean-shaped organs found in major clusters, including the cervical regions in the neck, the axial nodes in the armpits, and the inguinal nodes in the groin region. Lymph nodes are not only lymphatic tissues in the body. The tonsils, spleen, and thymus glands are also notable lymphatic tissues. The tonsils are located in the back of the mouth, and they produce lymphocytes and antibodies. They are strategically positioned, hanging down from a ring forming the junction between the mouth and pharynx, enabling them to protect against inhaled and swallowed foreign bodies. The spleen is not connected to the lymphatic system like lymph nodes are, but it is still classified as a lymphoid tissue, as it still plays a role in the production of white blood cells in the immune system. Its other major role is to filter blood, trap foreign material, and remove damaged and aged red blood cells, white blood cells, and platelets. Finally, the thymus gland is a small butterfly-shaped gland located on the superior surface of the heart, and plays a key role in programming the immune system to allow it to distinguish the body's own cells from foreign cells. The lymphatic system has 3 major functions, namely tissue drainage, fat transport, and immune responses. Interstitial fluid bathes most human cells and has a composition similar to blood plasma, and an average human adult has between 11 and 12 litres of interstitial fluid filling interstitial spaces. It is a complex, oxygen-rich mixture that has several components including sugars for metabolism, amino acids for protein synthesis, lipids for metabolism and membrane synthesis, hormones, and waste metabolic products. Approximately 85% of interstitial fluid is reclaimed into the blood at the venous end, while the remaining 15% is added to the interstitial fluid bathing the cells. Interwoven among capillary beds are blind-ended lymphatic capillaries, with walls that form overlapping flaps functioning as unidirectional mini-valves. They soak up excess fluid from interstitial spaces, and the lack of muscular wall or valves means that they rely on the capillary action to move fluid in one direction. The second function of the lymphatic system is the absorption of fats and fat-soluble vitamins from the digestive system, and the subsequent transport of these substances to the venous circulation. The mucosa that lines the small intestine is covered with the finger-like projections called villi. There are blood capillaries and special lymph capillaries, called lacteals, in the center of each villus. The blood capillaries absorb most nutrients, but the fats and fat-soluble vitamins are absorbed by the lacteals. The lymph in the lacteals has milky appearance due to its high fat content, and it is called chyle, spelled C-H-Y-R-E. The third and probably most well-known function of the lymphatic system, the one that I've discussed the most, is defense against invading microorganisms and disease. Lymph nodes and other lymphatic organs filter the lymph to remove microorganisms and other foreign particles. Lymphatic organs contain lymphocytes that destroy invading organisms. Like the rest of the body, the lymphatic system is susceptible to disease, infection, and other problems. For that, I'll now hand over to Anupam.
Lymphatic system, like all other systems of the body, is prone to many different types of diseases, and I'm going to be going over some of the most common of ones. Lymphadenopathy is the medical term for the enlarging or swelling of the lymph nodes. This can be caused by infection, inflammation, or, in rarer cases, cancer. Common infections that can cause enlarged lymph nodes include strep throat, mononucleosis, HIV infection, and infected skin wounds. Lymphadenitis refers to lymphadenopathy that is caused by an infection or inflammatory condition. One specific type of lymphadenopathy that I'm going to talk about is tonsillitis, something that I'm sure a lot of people listening to this have heard of. Tonsillitis occurs when the tonsils, which are part of the lymphatic system, become infected and inflamed. They're two lumps of small soft tissue, one on either side of the back of the throat. And as part of the immune system, they trap germs that make you sick. When tonsils become infected, they get swollen and sore, and swallowing may hurt. Tonsillitis is also called tonsillopharyngitis, but many people just call it sore throat. It's extremely common, and most people will have tonsillitis at least once in their lifetime, which is why so many people have heard of it. It's even more common in children, but it can affect people of all ages, and it's also why a lot of people have their tonsils removed in early childhood, as a way to prevent tonsillitis or to treat tonsillitis. Symptoms of tonsillitis usually come on very suddenly, and common symptoms include a sore or scratchy throat, pain or difficulty swallowing, red, swollen tonsils and throat, whitish spots on the tonsils, fever above 100 degrees Fahrenheit, swollen lymph nodes or glands on either sides of the neck on your ears, a stomach ache or vomiting, and that last symptom is more frequent in young children. Tonsillitis can be caused either by a virus or a bacteria, and viral tonsillitis makes up 70% of cases, and this is usually by a virus such as cold or flu. Bacterial tonsillitis, also known as strep throat, is mainly caused by the Streptococcus bacteria. Now let's talk about another disease of the lymphatic system, lymphedema. This can result from a blockage in the lymphatic system caused by scar tissue from damaged lymph vessels or nodes. Lymphedema is also seen when lymph nodes are removed from those who've had surgery or radiation to remove cancer. The buildup of lymphatic fluid is most commonly seen in parts of the arms or legs, and its main symptom is swelling in all or part of a limb or another part of the body. It can be quite difficult to fit into clothes or jewellery, and watches can feel tight if this swelling occurs. At first, the swelling comes and goes in waves, and it gets worse during the day and goes down overnight. However, without treatment, it becomes more severe and more persistent. Other symptoms can include an aching, heavy feeling, difficulty with movement, repeated skin infections, hard, tight skin, folds developing in the skin, wart-like growths growing on the skin, and fluid leaking through the skin. There are two main causes of lymphedema. In primary lymphedema, it's caused by faulty genes that affect the development of the lymphatic system. This can develop at any age, but usually starts during infancy, adolescence, or early adulthood. Secondary lymphedema, on the other hand, is caused by damage to the lymphatic system or problems with the movement and drainage of fluid in the lymphatic system. Usually, this is the result of a cancer treatment, but can also be because of infection, injury, inflammation of a limb, or lack of limb movement. It's thought to affect over 200,000 people in the UK, and primary lymphedema is much more rare, being a genetic condition, affecting only 1 in every 6,000 people. Secondary lymphedema is much more common, and makes up the vast majority of cases. Secondary lymphedema affects around 2 in 10 people with breast cancer and 5 in 10 people with vulval cancer following their treatment, and about 3 in every 10 people with penile cancer get lymphedema. Lymphedema can also lead to further complications, one of those being cellulitis, and it's the most common complication. Cellulitis can be extremely serious if it's not treated quickly. Cellulitis is a bacterial infection of the deep layer of skin, or dermis, and often affects people who have lymphedema. And this is because of the buildup of fluid in your tissues, making you more vulnerable to infection. Specific symptoms of cellulitis include redness and a feeling of heat in the skin, pain and increased swelling in the affected area, chills, or a high temperature. Lymphedema on its own can be very mild or be quite painful, disfiguring, or disabling, and with added complications like cellulitis can even be fatal in extreme cases. People with lymphedema are always at risk for serious and potentially life-threatening deep skin infections. Finally, the lymphatic system, like all other systems of the body, is also prone to developing cancers. Cancers of the lymphatic system are called lymphomas and occur when lymphocytes within the system grow and multiply uncontrollably. There are several different types of lymphoma, such as Hodgkin's lymphoma and non-Hodgkin's lymphoma, but in almost all cases, cancerous tumors form which block lymphatic ducts or be near lymph nodes and interfere with the flow of lymph throughout the node and throughout the body. This can cause other bodily processes to fail, and over time will lead to the death of the patient. It's also quite common for cancer caused by lymphoma to end up leading to some of the other conditions I talked about, and even if it's treated, it can lead to conditions such as lymphedema. As such, cancers of the lymphatic system are extremely dangerous. But we've talked a lot about the different types of diseases the lymphatic system can get. How would we treat any of them? And for more information on that, I'm going to pass over to Shrey.
So let's look at some of the diseases that Anupam was talking about, starting with lymphadenopathy. To diagnose this, you probably go to your GP, and then they do a range of tests, for example, blood tests to look for signs of infection, as well as doing biopsies. They'd usually take a sample of your lymph tissue and then look at it under the microscope to see what's happening. And they might also take fluid from your lymph nodes and then grow them to culture them to see which bacteria grow. And if it's caused by a bacterial infection, they'll probably give you antibiotics to obviously fight that infection. And for the pain and fever, common over-the-counter medications such as paracetamol would probably be prescribed. You can look at our video about paracetamol after this one. And also, to reduce the swelling, they might give you some medication. In extreme cases, there might be the need for surgery in order to drain the lymph nodes of pus buildup, but this is quite rare normally, and obviously we want to avoid doing surgery because of operative risks. Apart from what the GP can or doctors can give you, just resting and also having warm compresses or hot water bottles can be quite useful in lymphadenopathy. That can be done at home. Moving on to tonsillitis. Really, with tonsillitis, you want to stop the infection spreading to other people. So that's why if you have tonsillitis, it's advised to stay off work if you're an adult, and obviously if you're a child, like don't go to school and stay at home. At home, it's advised to rest, have cold drinks to soothe the throat. Again, over-the-counter medications such as paracetamol, and you can also gargle with salty water. However, this isn't recommended for children. If it's a bit worse, you can go to the pharmacy and they can give you lozenges or throat sprays or antiseptic solutions to try and help with the tonsillitis. But if it's bacterial, your GP might be able to prescribe you antibiotics to clear the infection. And as Anupam mentioned at the start, there can be surgeries to remove the tonsils as well. And but that's really only in kind of severe cases where you're getting recurrent infections of the tonsils, and therefore it's because again surgical risk is very we want to minimize that. And in terms of lymphedema, what's at least on the NHS, what's done is decongestive lymphatic therapy, also shortened to DLT. And although it's not a cure, it's more aimed at controlling symptoms with if you have lymphedema. And there are four main components, which are the compression bandages. And as I was mentioned before, the lymphatic system doesn't have like a central pump like the heart. So it requires muscles and capillary action to kind of move that lymph around. And basically all this therapy is about trying to get the buildup of fluids to like move around and kind of break up a bit more. So what these compression garments do is they kind of try and move the fluid out of the affected limb and like reduce the buildup of the edema. Also, skin care can be important, and this is mainly to like prevent infection and kind of make sure that it doesn't get worse. Exercises are very important because it doesn't have a pump. The movement of the muscle can help to can help with lymph drainage and trying to reduce the edema. And also you can have specialized massage for lymphedema called manual lymphatic drainage. And this is trying to, again, make the fluid flow away from where it's being built up. And generally DLT is a daily treatment for several weeks. It depends obviously how badly how bad your lymphedema is. And after this initial phase of kind of decongestion, you go into the second phase, which is maintenance. And that's about stopping the edema coming back, obviously. And in that is exercise, obviously, continuing to wear the compression garments. Maybe there can be some like massage that's not done by a specialist, just done at home. And also just making sure that you're not, if you see anything, any buildup, then you act on that and have some self-management of your condition to stop it recurring. So we've gone through a number of treatments for different conditions that affect the lymphatic system. Now I'll hand back to Adrian.
So I hope that covers the lymphatic system in its basics, from its structure, function, diseases, and possible treatments. Be sure to like, comment, and subscribe for more episodes of Medisodes, and see you next week for another episode.